Most people don't know how to brush their teeth, so we asked the people in London to prove it. Do you use an electric or manual toothbrush?
Well, I have an electric toothbrush, but I usually don't turn it on. I just use it manually.
When you're cleaning your teeth in the morning, I think most people just imagine it as a quick and easy 2-minute task. But is it really that simple? Despite often being overlooked, the straightforward task of brushing your teeth is one of the most important things to do for your mental and physical health. Will this oversight put increased pressure on global healthcare systems, causing them to collapse? Or is toothbrushing going to become the next major health concern for future generations to come? Stick around to the end of this video to find out what the perfect way to brush your teeth is, shown by a dental professional. So why do you brush your teeth?
Well, I brush my teeth because obviously it's hygienic. I want to protect myself from having dental problems in the future, and I don't want to have bad breath.
I guess to keep it clean and for hygiene.
I brush my teeth because I have to remove all the plaques, all the dirt things in my mouth, the food residues and things like that. Yeah, so keep my mouth fresh.
To keep them clean, nice and white and fresh. Fresh breath as well.
How long would you say you brush your teeth for?
Less than 5 minutes for sure.
2 minutes, obviously.
Mostly I try to do 2 minutes, but usually ends up being about 30 seconds to a minute.
I'd say 2 minutes, per session, twice a day.
Do you use mouthwash or floss?
No, I use floss, but not mouthwash. I'm not a mouthwash person.
Yeah, mouthwash. Floss only if I have something in it.
I use mouthwash, I don't floss.
What do you think about while brushing your teeth?
That's a tricky one.
Well, if it's in the morning, I usually just think about the day ahead, I guess. If it's at night, I'll usually be listening to music while I'm brushing my teeth, so I'll just be, just vibing to that.
In the morning, I think of going to work or something. So, but at night time, I'm just thinking on my bed, obviously.
I do find myself daydreaming and just wandering into different sort of thoughts, but nothing specific, I'd say.
What ocean creature has the most teeth?
Probably some sort of shark. A hammerhead shark.
I don't know.
Maybe like a shark?
And I think I know shark, but land.
Which shark for marine? Which one do you think?
I think the whale, is there?
It's a great white shark with 300 teeth. But
I know there's something about shark.
how would you brush your teeth if you didn't have hands?
I'm sure there would be like a device attached to like your arms or something, and then it probably brushes your teeth.
Would you invent it?
Yeah, I'm a designer, so I guess.
Very good.
Yeah, I would probably come up with something.
How would you brush your teeth if you didn't have hands?
Oh no. If I don't have hands, what would I do? What would I do?
What would you do?
I think I'll use my toes.
In an average person's lifetime, how long do you think they spend brushing their teeth?
Every day twice into how many ever years you live, so that's probably like 5 minutes into to 10 minutes into your lifetime, I guess.
So how long over your lifetime?
I'm guessing at least like a few years.
It's actually 38 days. Do you use an electric or manual toothbrush?
Well, I have an electric toothbrush, but I usually don't turn it on. I just use it manually because I just find it easier to brush manually.
I use a manual toothbrush because I feel comfortable with that.
I have an electric toothbrush, so it does a lot of the work for me rather than a manual one.
Out of 10, rate 1 to 10, 10 being the best, how well do you brush your teeth?
I'll say 8. And my worst day is 8, yeah.
And why?
Because I'm in a rush.
Probably a good 7 out of 10.
And why?
Although I don't brush for too long, I'm very effective with it. I get all the, I brush the gums, everything, get all the good spots.
I'd say 7, probably.
I would say pretty fine.
Very good. And why? Why?
I had like braces before, so I think that gets you in the habit of like brushing your teeth.
Brushing your teeth is extremely important for your physical health and certainly has more benefits than just giving you fresh breath. It is important to brush your teeth to prevent gum disease, tooth decay and stains. Plaque is the transparent layer of food and bacteria that coats your teeth, and the build-up of this plaque is so problematic because it not only provides a home for bacteria, but it also acts as a medium that holds the acid they produce directly against a tooth surface. When acid production is active, for example after eating a sugary treat, the acids that form can seep out of the plaque in one of two directions. It can either accumulate underneath the plaque, which is directly against the tooth surface, or seep out into the mouth. This could cause tooth decay or gum damage. The best way to ensure the removal of this plaque is by brushing your teeth twice a day. Wait a second. What's that sound? And does it matter whether you use an electric or manual toothbrush?
It just depends on the person and their manual dexterity. Some people prefer to use the manual brush, some people prefer the electric. Generally, we find the electric brushes are easier to use. Alright, so yeah, people tend to fare better with those.
Brushing your teeth can also have a positive impact on your mental health. When you feel clean, your brain gets a jump start by producing endorphins that make you feel good. Endorphin production can also make you feel less stressed and in general can put you in a better mood, which offers a sense of well-being and improves your mental health as a whole. Before we get a dental professional to show the perfect way how to brush your teeth, here are 4 main factors to consider. 1. The type of toothbrush you use. It doesn't matter whether you use an electric or manual toothbrush, as long as you brush all the surfaces of your teeth. What does matter is that you use a soft brush. Vigorous brushing and scrubbing with a hard brush, combined with incorrect technique, can lead to significant sensitivity and loss of tooth structure. Number 2. The way you brush your teeth. The best technique can be achieved by doing the following steps. First, place the brush at an angle of 45 degrees from your teeth and gently start from the gum and brush towards the edge of the teeth in circular motion. Brush all surfaces of the teeth, inside, outside, chewing surfaces of both upper and lower teeth. Do a minimum of 2 minutes. Try to aim between 2 and 3 minutes if you can. And finally, don't rinse your mouth at the end, as some residue of the toothpaste is beneficial for your teeth. Number 3. When you brush your teeth. Brushing at least twice a day, once in the morning and once at night just before bed is best. Brushing at night is particularly important as the rate of decay is much higher at night. Number 4. The type of toothpaste you use. The most important factor about a toothpaste is the presence of fluoride. Over the course of time, fluoride slowly absorbs into the teeth, making them significantly stronger against tooth decay. Researchers believe there are several mechanisms by which fluoride achieves its cavity-preventing effect. 1. It reduces the solubility of enamel in acid by converting the very soluble hydroxyapatite into less soluble fluorapatite. Fluoride ions replace hydroxyl groups in the hydroxyapatite to form fluorapatite in the tooth enamel. A portion of the apatite crystal lattice can be seen showing the replacement of hydroxide for fluoride. Under karyogenic conditions, carbohydrates are converted to acids by bacteria in the plaque biofilm. When the pH drops below 5.5, the biofilm fluid becomes unsaturated with phosphate ions and enamel dissolves to restore balance. When fluoride is present, fluorapatite is incorporated into demineralized enamel and subsequent demineralization is inhibited. 2. It may exert an influence directly on dental plaque reducing the ability of plaque organisms to produce acid. 3. It promotes the remineralization of tooth enamel in areas that have been decalcified by acids. Plaque acids cause a demineralized subsurface lesion. Fluoride treatments remineralize the lesion with a more acid-resistant fluorapatite material. What's the best sort of toothpaste you suggest?
So most toothpastes are similar in their formulation. Some have whitening chemicals added in them, but usually that's just an abrasive. Some have a bit more antibacterial chemicals in them to try and help with gum disease. Some have desensitizers added in there to reduce sensitivity, like the Sensodyne toothpastes. But the main active ingredients in toothpaste are the fluoride and the antibacterial chemicals.
If you were talking to a patient,
Yeah.
how would you describe to them the perfect way to brush their teeth?
Basically, your aim is to angle your brush downwards. So the key things is keep your brush angled at 45 degrees to the tooth. So that way the bristles, say if that's your lower tooth, you want to point it down. And if it's your upper tooth, you point it up towards the gum line. So this is a manual brush. And you want to brush round and round in circles because you're following the pattern of your gum line, that sort of scalloped, rounded outline of the gums. So you want to go round and round to clean that gum tissue. If you brush across it like this, horizontally, or up and down vertically, you can damage the gum tissue and you can abrade it. People can get sensitive teeth from overbrushing where they've gone too vigorously. So it's important not to be too vigorous, but also to be firm enough to remove the plaque. That's the key thing. So the key thing I say, go in circles and keep it angled towards the gum line. And so here when you're cleaning behind your teeth, hold your brush vertically because the head can be too wide to reach properly behind your teeth. So if you hold it vertically, then you can clean more effectively behind. And when using an electric brush, it's a little bit different. The head spins round and round for you. It's just oscillating back and forth. And because it's doing that by itself, you don't need to do that. All you need to do is just guide it along. So you're just holding it and just letting it do its work. So it's easier. But again, when you're holding it, you've got to hold it correctly. So with these brush heads, you can hold them sort of halfway on the tooth and halfway down on the gum. And that way you're cleaning that junction between the gum and the tooth, which is the crucial area where your plaque will sit. That's your basic brushing technique.